The 55th annual meeting of the European Society for the Study of Diabetes took place from the 16th to the 20th September 2019 at Barcelona, Spain. EASD is one of the largest networks for diabetologists worldwide, with more than 5,000 active members from over 100 countries throughout the world. The results of the landmark trial verify vildagliptin efficacy in combination with metformin for early treatment of type 2 diabetes is an ongoing 5-year multinational, multi-ethnic study being conducted in 254 centers across 34 countries. The Verify investigators revealed whether the durability of glycemic control is improved by adding the dipeptidyl peptide base 4 inhibitor vildagliptin to the standard first-line treatment of metformin in people with type 2 diabetes who are drug native or have taken metformin for less than 1 month. Let us invite our expert to share the much-awaited results and express his take on the findings of Verify trial.
Hi, I'm Cliff Bailey. I'm Professor of Clinical Science at Aston University in Birmingham in the UK, and I'm here at the EASD in Barcelona, and we've just had the presentation of the Verify study. This is the comparison of early metformin and vildagliptin in combination compared with the sequential treatment with metformin first, and then when the patient fails to maintain an HbA1c of less than 7%, they then get vildagliptin added in. So if you like, it's early combination versus sequential or later combination. The key findings? Well, first of all, if you start with combination, you get more patients to maintain control for longer. And not only that, when in the long term patients are on combination and compared against those who had combination from the start, those who had combination from the start show much better glycemic control in the long term. So we see early benefits and we see later benefits in terms of glycemic control. Now, in addition to this, the Verify trial has been able to show that in a patient group at low risk comparatively of cardiovascular events, there are still nevertheless fewer events in those that started with combination therapy than those who did not. Now, this is still preliminary or exploratory evidence because only small numbers are involved, but at least it's an interesting indication. So, how will Verify influence the treatment of type 2 diabetes? Well, it probably won't change the position of DPP-4 inhibitors, which are usually used as add-on to metformin. But what it does show us is that early introduction of combination therapy provides much better results, and it also shows us that even in individuals who have quite good glycemic control at the beginning, nevertheless the use of the two agents clearly benefits the control of glycemia further down the line. So we're seeing here evidence that early combination is clearly advantageous and that it doesn't need to be delayed, as has often been the case, until glycemic control has got out of control. It can be started successfully early.
Thank you, Doctor, for sharing that invaluable piece of information. And it was indeed great to have you with us.